microphone. Here we're looking in your knee, up underneath the kneecap. Got some blood in your knee, quite a bit, coming down the medial gutter area. And we're going to come down along the medial gutter, and we're going to be draining it here a little bit. So look and see. This is the area of the tear of the medial ligament. You can see the blood pouring out of the back there. The medial compartment gap's wide open here, and there'll be blood in here. Blunt ionic trocar and another hook, please. Have the blunt trocar here for a second. Let me just poke that through. All right. Dr. Ting's here with me to help. There you go. Thank you. The bleeding is really fairly substantial. I think he's got a real capsular. What I'm concerned about is a capsular tear at the level of the meniscus. I'm going to change the fluid and go in here. Maybe that'll clear that. Go ahead and put that on there. Go in the scope. We're looking at the underside of the medial meniscus, which quite fortunately is in good condition. But obviously things gap open a little bit much back and back here. I can't. Boy, there's a lot of. There's just torn out right back here. Here's your tear back in here. We're right out in the back. Can I have the light up, please? Put the light up, please. He's got a peripheral separation right there at the level of the posterior meniscus. Thank you. That's okay. No, that's still stable, I think.
So it's just a flappus synovium.
Yeah, that's all it is, I think. There's the tear right there. Right. Boom. Oof. Okay. Over here. We're going to look at your anterior cruciate here, which looked okay on the MR, and I think it's still going to be all right. We can probably switch the water here now. Here's your anterior cruciate. Looks good, no hemorrhage in it. Posterior cruciate's in there. And based on all of our evaluations, there was no reason to suspect them as being abnormal. Now look at your lateral meniscus, which sometimes gets an impact or crush lesion as a result of the thrust you get that tears your ligament. Let me take here. Thanks, Art. Yeah, thank you. And we got a bunch of bleeding back here, too. So here we begin to see a little better. Put this under your lateral meniscus and probe it, and it looks good. Looks very good. There's no bleeding back here. No crush injury, no radial tear. Looks good. So it's a very complicated medial collateral tear, probably up above the level of the joint line, and with some posterior extension up the posterior capsule. Here's your cruciate, anterior cruciate again. Beautiful. Nice and tight. Posterior cruciate's right in there. Works.